Hi, everybody, and welcome to the Virtual Menopause Clinic YouTube channel. Don't forget to subscribe today. All right, today we're going to talk about what's going on up here. So just wait for the introduction and we'll get started. It's been a busy year for menopause news, and the North American Menopause Society, now known as the Menopause Society, published its review of non-hormonal treatments for menopausal symptoms. It's called the NAMS Position Statement, the 2023 Non-Hormonal Therapy Position Statement of the North American Menopause Society. And you know what? It's free, so I have put the link down in the information section. But let's talk a little bit about what it is. Now, there are a lot of women who cannot take hormones for menopausal symptoms, but we want to know that what we're offering to women is beneficial and actually not harmful. So an advisory committee of the North American Menopause Society reviewed all the literature to date on a wide variety of treatments for menopause. Now, as you can imagine, there are a lot of non-hormonal treatments. So they divided them into categories: lifestyle, mind-body treatments, prescription therapy, dietary supplements, acupuncture, and then other treatments and technologies. Let's do a dive in. All right, let's talk about lifestyle first. They did not recommend, based on the evidence, cooling techniques such as fans or avoiding triggers such as caffeine. You know what? I think if you've had hot flashes, you're going to know that those things they might work sometimes, but they don't tend to work a lot from my experience. So I'm not surprised at that one. All right. Although we know that exercise, particularly aerobic exercise, helps with the mood changes during menopausal transition, it's not recommended for vasomotor symptoms. And neither is yoga, for that matter. So a healthy diet, of course, makes a difference. And you need a healthy diet for all of your life, but dietary changes haven't given enough evidence to support the use for them as treatment for vasomotor symptoms or hot flashes for women. But weight loss. Now, we know that there is a huge association between weight and vasomotor symptoms. So weight loss tends to decrease them and should be encouraged for women who are overweight or obese. Next are the mind-body techniques. All right, cognitive behavioral therapy. It's gained a lot of interest and a lot of research has been done with it. It's been shown to help with vasomotor symptoms and it's recommended. Clinical hypnosis. It's a technique to enter into a very deep, relaxed mind-body state and with the use of imagery and suggestion to reduce symptoms. Symptoms like it's been used for chronic pain and anxiety really quite well, and it's recommended for women with vasomotor symptoms. However, mindfulness is used for a lot of different things. Right at this point, we don't have enough evidence for NAMS to recommend that it be used for the treatment of hot flashes or vasomotor symptoms in women. And then paced breathing. Nope, not recommended. All right, prescription therapies. There are many prescriptions that are not hormonal that are used or were developed for other things that have been found to benefit women with menopausal symptoms. The first category is SSRIs or SNRIs. You'll probably know about them being used for things like depression and anxiety, but they have been shown to reduce vasomotor symptoms for women and are recommended in menopause. Okay, gabapentin. That was, oh my goodness, it was developed decades ago. And it was initially used as a seizure medication. It's used for a lot of other things now, neuropathic pain, that sort of thing. It's also recommended, though, because it's been shown to be beneficial for women who have vasomotor symptoms. Now, there are side effects, so you have to be careful, actually, with all of these medications and with all these treatments. So make sure you know what the risks and benefits are of any treatment that you're taking. However, another medication that initially was used as an anti-seizure medication, pregabalin, is not recommended. No, there are too many side effects and there are other treatments that are beneficial. So it's off the list. And the same with clonidine. It's been around for decades and it was initially used to treat high blood pressure. And you might remember it being used for women with hot flashes. But the risks outweigh the benefits. There are other treatments available that work very well, so it's not recommended. Then there's oxybutynin. Now, this is used for overactive bladder. You think, oh my goodness, how is this going to help? But it does. Just be cautious, though, because long-term use has been associated with cognitive decline in older women. So because the data are limited for suvorexant, which is not available in Canada, it's not recommended. And the very first neurokinin B antagonist was developed specifically for hot flashes and is recommended. And I think we're going to be hearing a lot more about that category of medication in the future. Now, this advisory group went through research articles for a variety of herbal remedies, and basically none of them were recommended. And there are a few reasons why. And let's talk about a few of them. First of all, soy extracts, that sort of thing. There's mixed evidence about their benefit for women with hot flashes or other symptoms of menopause. And part of the reason is that the studies just aren't supporting it. They're not robust enough. Maybe we'll get more information later. The other part is not all women are able to metabolize soy to the chemical component that actually helps with hot flashes. So, all right, cannabinoids, cannabis. We want it to be a cure for everything, don't we? So it is now legal in Canada, but it hasn't been for very, very long, and is legal in some of the United States for recreational use. But because it had been illegal for so long, there's limited evidence and limited research about it. The research that is out isn't showing huge benefits, so it's not recommended at this point. Now, the study goes through a wide variety of herbal remedies, and I'm going to let you look at that because, again, the link for the position statement is down below. But I do want to talk about a couple of them. Evening primrose did not show benefit over placebo, not recommended. Similarly, no benefit from ginseng over placebo, not recommended. Now, one that you might know about, I certainly heard a lot about it when I first became a nurse practitioner, is black cohosh. And it was thought to have some estrogenic activity, so it was really highly recommended for a long time. But recent studies are showing that no, it doesn't provide the kind of benefit that we would expect from a product to help women with menopausal symptoms, particularly vasomotor symptoms. And in fact, has been cited in liver damage, so not recommended. So I'm going to let you look up the rest of those in the document. Now we're going to talk about whether acupuncture makes a difference in menopausal symptoms. I have this because I am certified to provide acupuncture to patients, and I've done so since 2015. And you know what? I find that they do get some really good benefit. Not everybody, but it's really quite impressive. However, studies aren't confirming that traditional acupuncture, like you see with me here, makes a huge difference for women. So it's not recommended. There is some promising evidence, though, for electroacupuncture. So stay tuned, and we might hear more about that in the future. There are a few final techniques, technological changes, and other treatments that I want to discuss. First is stellate ganglion block. Okay, now this isn't something that I've seen a lot of, but it is used for chronic pain syndrome. And it's an injection into different parts of the spine that create this relief. And it was tested with women in menopause, and it was found to provide women with relief. So it's a potential option, but to be used with caution. Chiropractic treatment was not found to relieve symptoms through research, so it was not recommended. And then finally, calibration of neural oscillations, which is something I'm not really familiar with. And again, I'm going to let you read up on it, but it was not recommended. So from this position statement, we've gained some really good information. We know now about more information about some of the treatments that are non-hormonal that are effective, and a little bit more about treatments that we just don't have enough evidence for, or maybe aren't quite as effective as we thought. It's worth keeping track of the position statements that are posted on the Menopause Society website because they provide great resources for you as a woman looking for treatment options, or if you're a healthcare provider, to support your patients through their menopausal symptoms. All right, have a great week.